Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
If the patient comes with complaints of pressure symptoms, mainly due to increase in size of the uterus, then directly we start with second line drugs in which gonadotropin releasing hormones are the best. Gonadotropin releasing hormone administration before myomectomy decreases the bleeding during surgery, but at the same time it leads to loss of plane in the fibroid. If patient comes with complaints of infertility, the most common cause of submucosal fibroid is infertility. So if it is a submucosal fibroid, then the fibroid is removed.
If there is infertility and if it is due to submucosal fibroid, then this submucosal fibroid should be removed. One more important thing is GnRH analogs. One, they control the bleeding, definitely. Second, they will also cause loss of plane of the fibroid. So that means loss of plane of the fibroid is if the fibroid rests here and this is the myometrium, and if this is the endometrium, and once you give GnRH analogs, then this plane will be lost and the fibroid becomes uneven, and even it will be ill defined, so that it might be difficult for removal of the fibroid.
thank you and thank you for watching.